My name's Neil Upson. I'm the Director of Operations for Scheduled Care. Prior to the Trust reorganisation, I was managing DGH Surgical Services and the Tertiary Cardiac Centre. And I'd just like to talk to you about some of the improvements that we've made in the last 12 to 18 months within the areas that I covered during that period of time. The first one is that we got a business case agreed through the specialist commissioners and also through the Trust Board to expand our cardiothoracic service. The advantage of that will be that we'll be able to undertake more open heart procedures and more thoracic procedures to ensure that patients have better access to cardiac and thoracic services. We've also been successful in managing to obtain and install a fifth mobile catheter laboratory, which again, as we move forward after the pandemic, will allow us to increase our capacity for dealing with patients who require diagnostic tests on their hearts and also electrical stimulation tests on their heart, and then them being treated appropriately. Moving on to the District General side of the service that I cover, we've introduced a service called UroLift, which is a treatment for benign prostatic cancer, which prevents the patient from having to have an invasive procedure. In essence, the prostate gland is lifted away from the urethra and allows the urine to flow freely without an invasive procedure. We've also invested in a diagnostic and treatment tool in our breast service called Scout, which allows us to make a small implant into the patient's breast, which then allows us to treat them more effectively. Moving on as well, I'm proud to say that our staff have worked extremely hard during the pandemic in managing our critical care unit. Our base establishment was for 16 beds, but during the height of the pandemic we went to 32 beds and we deployed staff from theatres and cardiac intensive care to supplement the general intensive care staff. Once again, I can only thank staff and say how proud I am that they've risen to that challenge during the pandemic. We've also, in the last 12 to 18 months, appointed 2 Associate Directors of Nursing who have been instrumental in improving our response to some of the governance issues that we experience within the division, our quality issues, and also a better response to some of our nursing issues, particularly around nurse recruitment, which I'm pleased to say is improving. Finally, and by no means least, the pandemic has given us the advantage of working differently. So now we have managers working off-site when appropriate and linking into meetings via video conferencing or Microsoft Teams as it's called, but we're also doing patient consultations as outpatients using the same methodology. This is allowing us to move more patients through the system more efficiently, which is also allowing us to improve patient care. Just like to conclude by thanking all of the staff in Scheduled Care for what they're doing, and we're moving forward in a new area now where we have a division that is dedicated to District General Services and a division that is dedicated to Tertiary Cardiac Services. Thank you very much.